Hey everybody, it's your human anatomy and physiology teacher, Mr. Poser. Today we are starting a new unit on a new system. It's the respiratory system. And we're covering the respiratory system right after we cover the cardiovascular system. And why is that? Well, they're really twin organ systems and they rely and depend upon each other for one main mission, and that is gas exchange. Bringing in oxygen, delivering it where it needs to go as far as your tissues in order to make ATP, and getting rid of the carbon dioxide and breathing it back out. So the respiratory system, the pulmonary circuit, is part of the cardiovascular system, right? So the respiratory system and the cardiovascular system are two peas in a pod. They cannot exist without each other, and you can't exist without it either, really, if you think about it. But yeah, there's a lot of interesting stuff going on in the respiratory system. So what we're going to cover in this video are the functions of the respiratory system as well as the upper respiratory tract. Then we'll get into the lower respiratory tract and breathing mechanics in later videos. Alright, so let's get started here. Let's get into our respiratory system. Four main functions of the respiratory system. These first two are the most important. Gas exchange between blood and external environment, and the exchange of oxygen and carbon dioxide within the lungs in the alveoli. Okay, so your lungs, that's the main component of the respiratory system, right? And your lungs' job is to bring in oxygen, drop it off in your blood so that your blood can take it wherever it needs to go, and pick up carbon dioxide and breathe it back out. That's what the gas exchange is, and that's really the name of the game. That exchange is really one of the main foci of our last two units. Okay, super duper important. Third function kind of enables the first and second functions. Air that comes into your lungs should be kind of clean, it should be warm, and it should be humid. It should be kind of moist, so that better gas exchange can occur. Air with a little bit of water in it, that's better for gas exchange. Warm, humid air. And finally, kind of a side effect of the respiratory system, its function is to produce sound for communication, like I am doing with you right now. And when we talk about the larynx, we'll talk about how that's able to even happen. All right. Before we get into everything else, let's talk about functions that are non-respiratory, which are defined as some actions caused by reflexes or voluntary actions. So the four functions that we talked about before, that's what the respiratory system does. Those are its goals almost. But here's some other functions that are also occurring that are considered to be non-respiratory, but they involve the respiratory system. So the first one is a cough. Coughing is trying to clear your lungs of debris and your lower respiratory tract of debris. So every time you, cough, what you're trying to do is collect dust and whatever else shouldn't necessarily be down there, and collect it in the mucus-filled, the mucus lining of your entire respiratory tract. It's called your respiratory mucosa, and it's going to trap some particles or some dust or whatever else should not be there. But by coughing, what you can do is collect that and bring it up to your upper respiratory tract so that you can swallow it and put it down your digestive tract. And get rid of it, and not have it be a problem in the respiratory system anymore. So that's what coughing is. That's the purpose of it. So your coughing is your body trying to get rid of whatever in your lungs. Hey, sneezing is something similar. Sneezing is clearing your upper respiratory tract, so your nasal cavity, your pharynx, and your larynx. So sneezing is, you only ever really feel it up here, right? It's trying to get rid of any debris or dust or anything else that shouldn't be in there. Yeah, and it spews it all over the place, which is kind of gross. But yawning is also a non-respiratory function. It's really just a deep breath, and we're not really sure what triggers yawns. We know that watching other people yawn, or thinking about yawning, or talking about yawning makes you want to yawn. I am going to use my mental fortitude and resist, but we know that all causes yawning. And you do it when you're sleepy, and we're not really 100% sure why you yawn when you're sleepy. So that is something that is still to be researched. Then finally, hiccuping. That is a phrenic nerve spasm. That's pretty much it. Your phrenic nerve is the nerve that branches off your spinal cord that activates your diaphragm. You can't really breathe out this diaphragm. It's a skeletal muscle. And when that nerve is spasming, or when it's sending impulses that it shouldn't, that's what hiccuping is. So eating a spoonful of peanut butter or drinking water in a rhythmic pattern is not going to help you get rid of your hiccups because it's a nerve spasm. That's what it is. Yeah, some guy had it for like 68 years. That's a world record for the longest hiccups. So just imagine that. How many spoonfuls of peanut butter do you think that guy ate? I don't know. All right, let's get into our anatomy a little bit of the respiratory system. The upper respiratory tract is what we're going to talk about today. That's your nose, your nasal cavity, your sinuses, pharynx, and larynx. And then your lower respiratory tract is your trachea, your bronchial tree, and your lungs. We are going to take a look at a diagram later on of the organs of the respiratory system, and we'll fill it out as a group. But some overall big organs in your respiratory tract, obviously your nose, which includes your nose and your nasal cavity, external, internal parts, the pharynx, your larynx, the trachea, the bronchi, which are the branches off of the windpipe or the trachea, and finally the lungs, which contain these microscopic little exchange capsules called alveoli, which we'll talk about in our lower respiratory tract video. Okay, each of these serve a particular function, so let's get into these. The nose is the only external component of the respiratory system. Boop. Air enters your system through your external nares, also known as your nostrils, right? So typically you're going to breathe in through your nose, right? Your nose contains two nasal cavities separated by a septum. Okay, so there's a bone called your vomer that you can find in your nasal cavity that will split up the nasal cavity into two separate groups. And that's also reinforced by hyaline cartilage. So this part of your nose is also cartilage, right? So your septum is made of both the vomer and of cartilage, just like the roof of your mouth there's made of bone, and then there's a soft skeletal muscle component as well. The nasal cavity has these projections, projections, I should say, called conchae. And really the job of those projections is to increase the surface area of that nasal cavity so that when air comes in, it can touch more of the internal respiratory lining, which is called the mucosa. And we'll talk about the mucosa in just a little bit more later on. But it has these kind of like grooves in it. And its job is to touch as much air as possible. All right, the mucosa, as I was just saying, I'll talk about it now. It's basically a layer of epithelial cells that's going to have these little hair-like projections on there called cilia, and it's going to be producing a lot of mucus. So yes, your entire respiratory tract is lined with mucus, okay? And when it's producing too much mucus, that could be a problem. But it needs that mucus. Its job is to moisten the air. Its job is to pick up dust and particles and all that kind of stuff. And make sure that the air that's coming into your lungs is going to be warm, it's going to be moist, and it's going to be clean. Okay? That's the job of your respiratory mucosa. But anyway, the nasal cavity can be separated from the oral cavity by both the hard and the soft palates. The hard palate is made of what's called your maxilla, right? We talked about that in our skeletal system unit. And the soft palate, which is a skeletal muscle that allows you to swallow. Okay? Olfactory, also known as smell receptors, are located in the mucosa, as we were just talking about. It's an epithelial layer on the superior surface of the nasal cavity, right? So at the superior surface of the nasal cavity, there's special receptors that are going to allow you to smell things. So they're going to pick up a molecule that you breathed in from the air, and that when it picks up that molecule, it'll send a signal to the part of the brain, it's called the olfactory bulb, that will make sense of that and interpret the molecules so that you can smell things, which is a really important thing, especially if you're a dog or a pig or something like that. But you're not a dog or a pig. But you can still smell things, hopefully. But anyway, as I said, the whole cavity, and in fact your entire respiratory tract, is lined with this respiratory mucosa, which is this epithelial layer that produces a bunch of mucus. It moistens air, and I'm going to throw in traps dust and particles. Okay? So that's really the job of your nose, is to moisten the air that you breathe in and kind of like purify it and clean it a little bit, thanks to the hairs that are in there as well as the respiratory mucosa. Okay? And smelling is kind of important too. All right, but pharynx. Okay, once we go through the nasal cavity, okay, we are now in the pharynx, which you can find behind your oral cavity and your nasal cavity. So your pharynx is defined as the muscular passage from the nasal cavity to the larynx. And you can divide the pharynx up into three regions. There's the nasopharynx, which is behind the nasal cavity, the oropharynx, oro meaning mouth, right? So oropharynx is behind the mouth, and the laryngopharynx is inferior to the oropharynx. It's the most inferior region of the pharynx, and it's attached to the larynx, which is the next thing that we're going to talk about. The oropharynx and the laryngopharynx are passageways for both air and food. Think about this for a second, okay? Just think. Why is it that the tube that you use to breathe, to bring in that oh so precious oxygen that you can't spend more than a few minutes without, why would it ever, ever, ever be put next to the tube that you take food in? The food could block your air hole, your air tube. That doesn't make any sense, does it? Hopefully we'll talk about that in a future video. But yeah, think about that for a second. Why would those be right next to each other? Your esophagus and your trachea are like that. Who knows? Well, I do, but another time. All right. But yeah, your pharynx, and it connects your mouth to your nose, right? So last week I had rice come out of my nose when I laughed at a joke really hard while I was eating rice, and that can happen. And that little piece of rice went up my pharynx and through my nasal cavity and out my nose because I was laughing while I was eating. But there you go. All right, last component that I want to talk about in this video is the larynx, and in fact, I'm using that right now. I'm going to show you a picture in a second of a view of the larynx and the vocal cords. So the vocal folds or vocal cords, when you push air through them, they vibrate, and in fact, that's what all sound is, just vibrations of wiggly air. Yeah, that's what music and sound are. It's just wiggly air, right? So that's what I'm making with my mouth right now. I am pushing air from my lower respiratory tract through my vocal cords. I've compressed them in such a way that I'm able to make those vocal cords vibrate, and then I'm using the muscles in my face. I'm using my pharynx. I'm using all sorts of stuff, and I'm changing the shape of my larynx in order to make different sounds and different words and communicate with you right now. And that's actually what you do every day. So I'm going to show you a cool video of the larynx later on, or I might attach it to this video, put it in the description or something like that, of how really the larynx works, and it's really kind of spectacular. So the glottis, that is the opening between the vocal cords. I'll show you a picture of that in just a second. What you're seeing right here, okay, I have what's called an Adam's apple because I am a male. I belong to the male sex. Everybody has thyroid cartilage, and it's called thyroid cartilage because that's where your thyroid glands are, which is a topic for another unit on the endocrine unit, the endocrine system. Couldn't think of it for a second, but yeah, your thyroid cartilage, your entire trachea is reinforced by cartilage, and we'll talk about that in our next video. But you got a little bit extra right here, and men have a little bit extra right here as well, and that's what actually makes up the Adam's apple. It is cartilage right there. So you might be wondering, what is the function of the Adam's apple? It really doesn't have a function. There's some specific reason as to why men have a more pronounced thyroid cartilage than females do, but I don't know it off the top of my head. It might be worth a Google. And then, okay, finally, this is another thing that you might have heard of before. It's the epiglottis, and the epiglottis is basically like another just flap of cartilage. Cartilage just plays a big role here, and it's superior to the opening of the larynx. Its job is to make sure that your food doesn't get into your larynx and choke you, right? Sometimes it does, but seriously, how much sense does that make to put your food hole right next to your air hole? It doesn't make any sense. Okay, but anyway, yeah, that's what your epiglottis does. So when your epiglottis fails, okay, or when it's open and you swallow some food and your epiglottis is open, that means that there might be food going down in your air hole, which is a bad thing. Okay, so every time you swallow, you can't really breathe while you're swallowing. It's because your epiglottis is closed and you've closed off the larynx and the trachea, and so that your food can go into the right hole, which is the esophagus. All right, that's it for this video. In the next one, we'll get into the lower respiratory system. Oh, wait, this picture here. Okay, here's the epiglottis. Okay, here's that flap that will open and close to allow your air in and keep the food out. This is the trachea. Okay, so air is going to pass through here. The glottis is that opening there. There's the cartilage that are surrounding it, and here are the vocal folds. These two little white bands here, they vibrate, and it's actually kind of spectacular to watch when air is going through, and that's what actually produces your sound and your voice. So you can change the shape of your larynx in order to manipulate your voice. It's pretty cool. All right, that's it for this video. For real now. All right, bye.